Today's video is different from all my previous ones. In this video, we will be discussing the human skeleton. We will explore the names of different bones in the body and learn about their functions. Along with that, we will also take a look at some movements of the human skeleton. So, let's get started with the video. Welcome to Animated Orbit, where animation brings learning to life. The human skeleton is a remarkable and complex framework made up of 206 bones, serving as the foundation for the body's structure and functionality. It plays several critical roles, including providing support to maintain posture and bear the body's weight, protecting vital organs like the brain, heart, and lungs from injury, and enabling movement through the coordination of joints and muscles. Additionally, the skeleton is involved in blood cell production, which occurs in the bone marrow and acts as a storage site for essential minerals such as calcium and phosphorus. The skeleton is divided into two main parts: the axial skeleton, which includes 80 bones such as the skull, spine, ribs, and sternum, and the appendicular skeleton, consisting of 126 bones that form the upper and lower limbs, shoulders, and hips. Interestingly, the skeleton makes up about 15% of the body's total weight, with the femur thigh bone being the longest bone and the stapes bone in the ear being the smallest. Throughout life, the skeleton undergoes continuous changes, including growth, fusion, and remodeling, adapting to the body's needs and ensuring its strength and stability. Phalanges are the bones in fingers and toes, essential for movement and flexibility. Metatarsals are foot bones that support walking and balance by connecting the ankle to the toes. Tarsal bones are the group of 7 bones in the ankle that provide stability and flexibility for foot movement. The fibula is the thinner bone in the lower leg, supporting muscles and stabilizing the ankle. The tibia is the thicker, weight-bearing bone in the lower leg, connecting the knee to the ankle. The patella, or kneecap, is a small bone that protects the knee joint and improves the leverage of thigh muscles. The femur, or thigh bone, is the longest and strongest bone in the body, supporting weight and enabling movement. The pelvis is a sturdy, bowl-shaped structure that supports the spine, protects internal organs, and connects the upper and lower body. Phalanges are the small bones in fingers and toes, essential for fine movements and flexibility. Metacarpal bones are the 5 long bones in the hand that connect the wrist to the fingers. Carpal bones are the 8 small bones in the wrist that connect the hand to the forearm. The ulna is one of the 2 long bones in the forearm located on the side opposite the thumb, extending from the elbow to the wrist. The humerus is the long bone in the upper arm, extending from the shoulder to the elbow. Ribs are the 12 pairs of curved bones that form the protective cage around the chest, safeguarding vital organs like the heart and lungs. The sternum is a flat, elongated bone in the center of the chest, connecting the ribs and protecting the heart and lungs. The clavicle, also known as the collarbone, is a slender bone that connects the arm to the body, located between the sternum and the scapula. The cranium is the part of the skull that encloses and protects the brain, made up of several fused bones.
Flexion is a movement that decreases the angle between 2 body parts, like bending the elbow or knee. It typically brings body parts closer together, such as when you curl your arm or lean forward. Extension is a movement that increases the angle between 2 body parts, like straightening the elbow or knee. It typically moves body parts away from each other, such as standing up straight or reaching out. In the neck, flexion occurs when you tilt your head forward, bringing your chin toward your chest. Extension occurs when you tilt your head backward, looking up toward the sky. The backbone, spine, flexion occurs when you bend forward, bringing your chest closer to your knees. Extension occurs when you arch your back backward, straightening or leaning backward. In the arms, abduction occurs when you lift your arm away from the body, moving it sideways, like raising your arm to the side. Circumduction in the arms is a circular movement that combines flexion, extension, abduction, and adduction. It happens when you move your arm in a circular motion, like when drawing a circle in the air with your hand. Head rotation occurs when you turn your head from side to side, like shaking your head to say, no. It involves movement around the vertical axis of the neck. Lateral rotation, rotating the leg outward, making the toes point away from the body. Medial rotation of the leg occurs when the thigh or lower leg rotates inward toward the body's midline. This makes the toes point inward, as seen when turning the knees slightly inward while standing or walking.